Hi, my name is Pepe Juan and I'm the nurse.
Hi, my name is Rina Liz Urdaneta and I'm the charge nurse.
Hi, my name is Vitra and I'm the risk management.
Hi, my name is Jaylima Urdaneta and I am the chief nurse officer.
Hi, my name is Kwang and I'm a slave of nursing.
Thank you all for joining this internal review meeting. We are here to discuss the recent incident involving Miss Rosy Jackson, who was mistakenly given another patient's medication. Nurse Pepe, can you explain what happened, please?
Yes, I was working the night shift at Capital City Rehab. I received the MAR and began administering medication for the patient before discharging her. I later found out that Miss Jackson was given antihypertensive medication prescribed to another patient, something she's severely allergic to.
Then here's kind of the question. Was the patient identity verified before the medication was given?
Unfortunately, I checked the room number but failed to confirm her wristband and didn't double check the medication label. I know that's a breach of the sixth right of the medication administration.
Let's revisit those right for everyone. The right patient, right medication, right dose, right time, right route, right documentation. This error violates at least those three of those rights.
Okay, it's important we understand that this is not just about human error. It's about a system failure. So what process was bypassed?
So when we reviewed it, it showed that there was no barcode scanning was used, and then the meds were not verified against the MAR properly. I'm pretty sure that there was no double check system in place for those high risk medication either. And then in that day, the staffing was low, which increasing the workload and distraction for the nurse. And there's also might have a chance that the pharmacy's labeling process have contributed to the confusion.
So multiple systemic factors increase the likelihood of error. What immediate actions were taken once the error was identified?
Well, Ms. Jackson developed throat swelling and the provider was notified immediately. She was transferred to ICU, placed on a ventilator, and later into the medically induced coma. I report the incident through the facility error reporting system.
And that is critical. Reporting medication errors promptly allows us to respond clinically and investigate systematically. We also send a formal apology to the family and initiate a root cause analysis.
Okay, so let's clarify for the record. First, what is a medication error? Is any preventable event that may cause or lead to inappropriate medication use or harm? And second, who is responsible? Ultimately, the facility and the nurse both hold responsibility. The nurse for administration and the facility for lacking safeguards.
So for us, in terms of prevention, we're now mandating the use of barcode scanners, also auditing med passes quickly, and then restraining the staff on patient identification and the MAR verification protocols.
So from the regulatory side, we will evaluate the facility compliance with the state medication administration standard, and this include possibly disciplinary action and monitoring corrective measures.
We also need to address the culture here. The nurse was told by a peer that it was a patient's job to read their meds, and that's unacceptable. So the responsibility for safe administrations lies with us, not our patients, okay?
Exactly. Going forward, we must foster a non-punitive culture where nurses feel supported to report mistakes, and as systems are designed to prevent them.
I deeply regret what happened. I accept responsibility, and I want to be part of making sure this never happens again to another patient.